The moment you realize you can't get medical help, everything changes, not because the situation is immediately worse but because the responsibility shifts to you. At first, the reaction is almost automatic. You reach for your phone. You think about calling someone. You expect guidance to be available, but then it hits you there's no immediate help coming, and that's where most people freeze, not because they don't care, not because they're incapable, but because they've never had to operate without external direction. So the mind starts racing. Is this serious? Am I overreacting? Should I wait, or act now? That hesitation becomes the first real obstacle, because in many situations, time isn't just important, it shapes the outcome. So you try to assess the problem. Maybe it's a fever. Maybe it's pain. Maybe it's something visible, like a cut or swelling. You look at it. You think about it. But something feels off, not the symptom itself, the uncertainty around it. You don't know what matters, and what doesn't. So you stall, and while you're stalling, the situation either stabilizes or slowly gets worse. This is where frustration begins to build. You try logical steps. You search for information. You compare symptoms. You try to match what you're seeing with something familiar, but the more you search, the more possibilities you find, and instead of clarity, you get overload. Now you're not just dealing with the issue, you're dealing with doubt, and doubt changes how you act. Sometimes it makes you delay too long, other times, it pushes you into actions that aren't necessary, or even helpful, and that's the hidden layer most people don't see. The visible problem is the lack of medical help, but underneath that, there's something deeper, the absence of a decision-making structure. For most of your life, that structure was external: doctors, systems, protocols. They filtered complexity for you. They turned uncertainty into direction. Without that, everything feels equally urgent, or equally unclear. It's like trying to navigate without a reference point. At first, you look for replacements, advice online, home solutions, anything that feels like guidance. Some of it works, some of it doesn't, but without a way to evaluate it, every option carries the same weight, and that's where mistakes happen, not because people choose wrong intentionally but because they don't know how to prioritize. This is the turning point. The real issue isn't the absence of medical help. It's the absence of structured thinking under pressure. Once you understand that, the focus shifts from, what do I have, to, how do I decide? Because when you can't rely on immediate help, your first job isn't to fix everything. It's to understand the situation clearly enough to avoid making it worse. That means observing before reacting. It means recognizing patterns, what's stable, what's changing, what's escalating. It means separating discomfort from danger. And that alone reduces a huge amount of unnecessary action. From there, the goal isn't perfection. It's appropriate response. Sometimes that means doing something simple, sometimes it means doing nothing and continuing to observe, and sometimes it means preparing for escalation. But those decisions only become possible when you're not overwhelmed. That's why preparation isn't just about tools or supplies. It's about reducing uncertainty before you're inside it, understanding common situations, recognizing how problems evolve, knowing what signals actually matter, because when those pieces are in place, something shifts. You don't panic as easily, you don't rush blindly, you don't freeze, you think, and that changes everything, not because you suddenly have all the answers but because you're no longer reacting without direction. So when medical help isn't available, the question isn't just, what should you do? It's, can you think clearly enough to decide? Because in those moments, clarity becomes your most valuable resource. If you want to go deeper into this, there's a structured breakdown in the description that walks through how to approach these situations step by step, and if this kind of perspective helps you handle uncertainty with more clarity, consider subscribing. Staying calm is not passive. It's a skill.